Team Kushner. Today I'm going to be discussing the health policy. Basically, we're going to be focusing on childhood overweight policy brief. So, according to the WHO, the UNICEF and World Bank estimate of 2012 and 2013, the number of overweight children worldwide has increased from 32 million to 42 million worldwide. Occurrence of overweight children under 5 years of age has increased from 3% to 7% in Southeast Asia and 1 to 19 in Southern Africa, 4 to 13 in the United States as of a 2016 survey data. If these trends follow, the incidence of overweight worldwide in children will rise to 11% by 2025, up from 7% in 2012. In the United States, the overall percentage of children and adolescents affected by obesity has more than tripled since 1970, according to the Weight of the Nation Early Care and Education Policy. As per data from 2015 to 2016, almost 1 in 5 school-aged children and young people have obesity. Obese children are at a higher risk of developing type 2 diabetes, high BP, asthma, low self-esteem, depression, respiratory problems, social isolation, sleep disorders, and even liver disease. Here is a chart where the rate of childhood obesity in the 100 most populated nations. So United States is the highest. Saudi Arabia is the second highest, and the lowest is Mexico and Malaysia, according to prevalence and the percentages in the Newsweek. Here we have another chart here where fetal and infant malnutrition, low birth weight and compromised body composition, impaired mental development, higher mortality rate, elderly malnutrition, reduced capacity for care, um, adult malnutrition, adolescent malnutrition, which reduced intellectual potential and reduced school performance. So the list goes on and on. So the responses and the policy options. The policy change would act as the key tool that would help to reduce the childhood obesity problem that is intensifying at a rapid rate. Since the healthcare concern acts as a key risk factor for diabetes, cardiovascular diseases, and various kinds of cancers, it is high time to design an effective policy-based intervention. The policy would act as a key tool that would encourage integrated participation so that childhood obesity could be managed and curtailed in an effective way, according to the WHA nutritional targets of 2025. Centers for Disease Control, the CDC, funds state-level efforts to prevent and control obesity. Under CDC's Division of Nutrition, Physical Activity, and Obesity, 25 states receive funds to prevent obesity and other chronic and implement obesity prevention initiatives in the early care setting. So some of the objectives of early care and education policy is to educate administrators about the potential health benefits of limiting screen time, improving nutrition, increasing physical activity, supporting breastfeeding in child care settings, encourage child care providers to identify improvements for provision of healthier foods and beverages, breastfeeding support, and physical activity. Also, integrate practices of improved nutrition, reduce screen time, enhance physical activity or professional development, and developmental educational opportunities. Increase access to physical activity opportunities and healthier foods opportunities with joint use agreements, preschool programs, and food purchasing cooperatives. So, another objective of childhood overweight policy is the occurrence of 7% worldwide childhood obesity as of 2012 should not rise to 11%. Should not rise to 11% in 2025, and it should be limited to 8 to 9% or less. The number of obese and overweight children should not increase to 70 million in 2025 as forecasted, and should be limited to 50 million or less, according to the Weight of the Nation Early Care and Education Policy Review of 2019. To create a supporting environment that promotes physical activity from the early stages of life, to make sure that there is a set of authoritative and internationally approved food-based dietary guidelines to maintain and improve nutrition in children, to improve nutritional status with healthier dietary practices. In conclusion, in order to reduce the instances of childhood obesity, the comprehensive policies like early care and education policy and childhood overweight policy are essential since they involve all the critical participants affected or influenced by the public health issue. These holistic approaches will make sure that all the members that have been identified in these policies would act in a responsible manner in order to control the childhood obesity issue. And that's it for now. Thank you very much, everybody. Have a nice, wonderful holidays, and have a nice weekend. Thank you. Bye bye.